Commissioner Shortall.
Thanks, Chair. I'd like to welcome our visitors. I think it's important to point out just at this point that we're now just coming to the end of year 5 of what was supposed to be a 10-year reform programme under Sláintecare. And I have to say that when it comes to regionalisation, I think the system has stalled, if not that it's gone backwards. And my heart sinks too, listening to the 2 presentations this morning in relation to regionalisation. You know, Mr. Reid spoke about the senior management team having to own and drive reform. I don't see any evidence of that here this morning at all. There's no sense of, you know, driving a reform programme. What we're seeing, I believe, is capture of the reform programme. And I just want to support my contention that that's actually what's happening. In 2019, the geographical regions were agreed for the regional structure and the map was provided. That was 2019. They were announced by then Minister Harris, July 2019. Last year in the Strategy and Action Plan, we were told that, you know, with the geographical areas agreed, a business plan was being produced. And then we needed to address the issues of clinical governance, corporate governance and accountability, population-based approach to service planning and integration of community and acute services. So I was hoping to get an update from you this morning in relation to those areas, what preparation you were doing in relation to accountability legislation and also in relation to population-based approach to the allocation of resources. However, when I looked at the email that Deputy Cullinan referred to earlier, I see then in the following paragraph that you, Mr. Watt, are talking about expanding the remit of hospital groups to include community services. Now, a person who makes that statement just doesn't get what Sláintecare is. That's not what Sláintecare is. The hospital groups will no longer apply. These are the regions that have been agreed by the last 2 governments. And these are the regions that you are required to operate to. But all of the indications are that you are seeking to rework what government policy was and what was provided for in Sláintecare. So what do you mean by expanding the remit of hospital groups to include community services, Mr. Reid? Because that is, or sorry, Mr. Watt, because that is nothing to do with the regionalisation plan as set out in Sláintecare.
Thanks, Deputy, for the question. So maybe the wording of the email could have been better. So what I understand it to involve is integration at a regional level.
Another letter.
5 times.
When it's the principle of what you're saying. It's expanding the remit of hospital groups to include community services. I think we're all concerned about the fact that, you know, we have a hospital-centric health service. You referred to that earlier. Mm-hmm. So what are you talking about expanding the remit of hospital groups? Can you just explain what your understanding is of regionalisation?
So I think we've spoken this morning about moving away from the hospital-centric system and not only talking about it, but we've set out, I think, in quite detail the enormous changes that are taking place, the primary care centres that are open, the community teams that are put in place.
Mr. Watt, sorry, will you stick to the question I asked you, please? Why would you suggest expanding the remit of hospital groups? What's your thinking on that?
I need to be allowed to answer the question, Deputy. Like,
yeah, please do.
You asked the question.
Yeah, please
You're
answer.
You're allowed to ask the question, and I'm allowed to answer the question. Okay, you don't get to ask the question and answer them. Okay, so
no, I'm not.
What I meant by
I'm asking you to answer the specific question I asked Mr. Watt.
So what I meant by that is to have integration. So it's not extending the remit of hospital groups is probably the wrong way to put it. It's establishing a new structure that will encompass the full range of services at a regional level.
So what's your understanding then? Sorry, time is short. What's your understanding then of what would happen to hospital groups in a regional structure?
They will be subsumed into the new structure, structure. So the new structure would encompass the full range of services across all the different.
The structures that have been agreed, the geographical areas, are entirely different to the hospital groups. So why would hospital groups arise at all? We should be talking about hospitals, not hospital groups.
Sure. Yeah, sure. That's true. So there had to be an alignment, obviously, between the existing structures that have to now be aligned with the new geographies that we've set out. And so the new structures would need to reflect those new geographies. So in effect, there will be a new structure, a regional health authority, which would subsume the activities of the CHOs and the hospital groups. And this new entity will be completely different. No, but you're repeating that.
There wouldn't be hospital groups. And there'd be a realignment of hospitals.
I think I said that the new structure would subsume the hospital groups and would subsume the CHOs into a new entity that would provide care across the full spectrum, all the way from community to hospitals.
What you would appear to be talking about is hospital groups subsuming the CHOs and the community services.
I think we're looking at new entities here, and I understand that the boards
what do you mean you
of the hospital groups that we.
What do you mean you think? There are new entities proposed. They've nothing to do with hospital groups. So do you understand actually what's contained in the Sláintecare recommendations?
Absolutely. So it's a new entity that would carry out now the functions that are carried out by the existing entities, which would be collapsed and which would cease, and there'll be a new entity that will provide the integrated care right across the piece. That's my understanding of it.
Sorry,
and then we would have then. Am I going to be allowed to answer any question? Like, am I not allowed to answer any question? Fine. I'll try to answer your question now several times.
It is extraordinary, Mr. Watt, that just a few months ago in September, you were talking about expanding the remit of hospital groups to include community services. And that, I can only come to the conclusion that you don't get Sláintecare and that you don't have any understanding of the regionalisation structures that were proposed, which are a central element of the reform programme, and indeed which we were told last year by Laura McGahey and Tom Keane that this was one of the main reasons why they resigned, because there was no appetite in the Department of Health or the HSE to actually restructure and devolve power and introduce legal accountability for the provision of services. And I can't help but seeing now and understanding fully the reasons why those two people resigned. I want to ask you, in relation to that document...
That's a complete mischaracterisation
in relation to
what I said. Completely mischaracterisation.
I can only come to conclusions based on what I'm hearing from you this morning and what I read from you in an email just last September. So I'm going back to the, excuse me, I'm going back to the...
what I said in the email.
Excuse me.
And I tried to clarify my understanding of it. And you haven't let me answer any of your questions without interruption.
I can only see what you have written down in black and white. And that concerns me greatly, because it brings me to the conclusion that you don't understand what regionalisation
is, do not accept
or you're seeking to block.
I don't know how you could infer that conclusion.
Okay, I think most people would come to the same conclusion reading that. Anyway, I want to move on. I want to move on then. That strategy and action plan 2021 to 23. In that, a business plan was to be produced last year. And I want to ask you, has that business plan been produced? Does it exist? And I also want to ask you in relation to an integrated financial management system, which we're told you don't have, in spite of it being 17 years since the HSE was existed. So when can we expect to see the business plan for regionalisation, and when can we expect to see an integrated financial management system?
Chair, I'm happy to take the latter or both as well.
Well, could I ask about the business plan first? I asked Mr. Watt about that.
Yeah, so we're
I could speak to the business plan, Robert, if you like.
Yeah, Mirish might come in. Thanks, Mirish.
Thank you, Deputy, and I can assure the Deputy that the senior management teams of the HSE and of the Department of Health are very committed to the vision for regional health areas set out in the Sláinte Care report and to the achievement of comprehensive person-centred integrated care.
Sorry, when will we see the business plan?
Yeah, so the business plan, as you will know, Deputy, was a requirement when the government agreed to the geographies of the 6 regions in 2019. The government asked that business case be presented at the next stage to set out the next steps and the way forward. So notwithstanding the pandemic, there was work progressed within the department to do that business case. It sets out the rationale, the objectives, the demand analysis, and looked at options for the development of regions and regional healthcare areas. And that looked at a number of areas as is versus a HSE local model or a HSE separate model. And while we arrived at
when will it be completed?
It's very near complete. It has been considered by the HSE executive, by the HSE board in recent months. We are taking input from the Department of Children and Disability also, conscious that the disability policy will move to them and our shared commitment to integrated care. So the business case is a requirement from us in advance of bringing a memo to government on an implementation plan. So we will have that ready, as Robert says, within the coming weeks. We're finalising the business case now, and that will underpin
when will we see the financial management system?
Yeah, Deputy, and if I can just touch on something, because you did quote myself also in relation to the regions and commitment to regions, and I will take the IFMS as well, just to say, and I won't go back over the commitment of what we've been driving and what's important for the next phase, but I do want to address the point around our commitment, and you referenced resignations previously, won't go through all of that. I took this job on the basis of driving Sláinte Care and driving reform and making it better for the public. I can't go back over 10 years what happened, but I can go back over the past 2 years. And I think we do need a bit of a reality check. If anybody thinks that in the middle of a global and a national pandemic that we were having, when our can I please?
We've heard all this before, Mr. Reid. We've heard all these excuses
Roisin, do you want me to cut off the section because you're way over time and you've asked far too many questions to get in within the 10 minutes.
Sorry, Deputy.
Which we're supposed to get an answer.
Deputy, I was referenced as not committed to change, so I think it's important I address my own professionalism and character in this one. It's just to demonstrate that I am committed to it, and I was making the point. My priority in the past 2 years, and I make no excuse for it, was protecting the public, protecting our patients and protecting our staff. And if anybody has been involved in any change management in their lives would say that's not the time where you do a massive, probably one of the biggest restructurings that the state has ever gone through. So I make no apologies. The time was not right to do that. Specifically in relation to IFMS, Deputy, just to make a few points. We've set out, we've funded, I can't talk about 17 years ago, or I can't talk about the past 2.5 years. Thanks to the Department, the Minister, Government, we've secured 82 million euros to deploy an integrated financial management system. It's quite a complex system. It's going to be rolled out, or the design phase is being worked on throughout last year. We have had issues with the systems integrator that we're in discussions with about termination. We are going to procurement for further systems integration. However, the process is continuously moving on seamlessly. The reality of it is the total, about 80% of the total spend activity across the entire health sector will be encompassed by the year 2025. However, we will start during the end of this year to start load some financial data for the Eastern region and TUSLA that will go live later in in 2023. So it's a very significant programme, massive design of a new integrated financial management system. Yes, you are correct. It's a big miss. It's a big loss that we don't have one, but we have funding for it and the board are overseeing its deployment.
Okay, I need to move on.